Good day, dear students. The topic of our lecture is professional oral hygiene in the prevention of periodontal diseases. The plan of the lecture is the following. At first, definition of professional oral hygiene, its purpose and objectives. Secondly, course planning of professional oral hygiene for the patient. Thirdly, professional removal of soft and mineralized dental deposits. And the last point is features of professional oral hygiene in children. Let's start from definition of professional oral hygiene. It may be defined as the scientific care of the teeth and mouth. You also can meet term prophylaxis, especially in American literature. The purpose of professional oral hygiene is to prevent the build-up of dental plaque. Therefore, according to the purpose, the objectives or approaches of professional oral hygiene will be the following. At first, mechanical plaque removal by individual, and secondly, plaque removal by dental professional. In case of professional plaque removal only and patient with poor oral hygiene, we work as a cleaner, because during the next visit of the patient, teeth will be dirty again and we will see soft deposits and calculus at the same or even more amount. Therefore, we should plan professional oral hygiene, and it consists of at least 3 visits. During the first visit, the items of our agenda are the following. Oral status and oral hygiene assessment, the motivation of the patient for the controllable risk factors of dental disease, planning prevention of oral diseases, selection of toothbrushing methods, oral hygiene tools and dentifrices, and toothbrushing training of a patient on model. Therefore, during the first visit, we solve the first objective of professional oral hygiene, mechanical plaque removal by individual. We should assess oral status, we should motivate the patient, inform the patient, educate him or her. During the second visit, we should do the following. Supervised toothbrushing and correction of individual oral hygiene. Correction of selected toothbrushing methods, oral hygiene tools and dentifrices, if it is necessary. Plaque removal by dental professional from 1, 2 or maybe all quadrants. It depends on clinical situation. But in the case of poor oral hygiene, we should repeat plan of the first visit again, because our patient is not motivated in proper way. Therefore, we can realize plan of second visit in proper way just if the patient follows our recommendations. During the third visit, our plan is the following. Of course, supervised toothbrushing and oral hygiene assessment. Then we should check the quality of cleansing subgingival areas in this treated during the previous visit quadrant, because swollen tissue should decrease their size and we can see areas hidden earlier. Removal of remaining dental plaque also should be done. And when the teeth of the patient is clean, we should identify photos of the mineralization and demonstrate them to the patient. And of course, we should do remineralizing procedures. Professional oral hygiene we do usually twice a year. But in case of periodontal pathology, frequency of professional oral hygiene or frequency of prophylaxis may be increased. Before start the professional plaque removal, we should do oral installation with antiseptic. For this purpose, we can use a solution of chlorhexidine or mouthwash with antiseptics. You should know that the most popular antiseptics in mouthwash are chlorhexidine, acetylpyridinium chloride, and triclosan. Also, if clinical situation requires it, local anesthesia may be done. Professional removal of soft dental deposits is divided into instrumental removal and apparatus removal. On the picture, you can see different tools for instrumental removal of soft dental deposits. Such tools as polishing gums and polishing brushes. Polishing brushes are preferable for the tuberal area, and polishing gums are softer and they are preferable and safe for the gingival area. Also, you can see polishing paste, polishing strips, a ring for polishing paste, and some other devices. When we speak about apparatus removal of soft dental deposits, we mean sandblaster, or very often we can use a term airflow, but airflow is the name of one apparatus, not the name of all such devices, but we can use it. Why no? The scheme of action is the following. Pressed air and powder are united into apparatus into air abrasive mixture. Then with water we will have abrasive spray. Abrasive spray go out from apparatus tip and clean the surface of the tooth. It is very important to do right choice about powder, about abrasive. Some powders are very abrasive and can be used just on mature enamel and just in supragingival area. And for patient with immature enamel, for children, and for patient with periodontal pathology, when we are working in subgingival area, we should use the paste on the base of glycine or erythritol. Therefore, powder should be selected according to the clinical situation in the oral cavity. During the removal of dental plaque by airflow, we must protect our eyes, nose, hands and claws, and also, of course, we should protect eyes, nose, hands and claws of the patient. Therefore, we work with suction and dental vacuum cleaner. We should use special caps, glasses. Other way, we and our patient will be in powder, or we will be covered by powder. Now about removal of mineralized dental deposits. Removal of mineralized dental deposits may be done with help of some chemical substances, so-called chemical removal. Also, we can use manual instrument, therefore manual removal is the name of such way of action. Also, we can use electromechanical devices and of course electromechanical removal, and also we can use laser. Please Choose the polishing paste in accordance with clinical situation, and don't use polydent number 1 in children if it is not necessary. And if you want to use it, ask the teacher and please protect the gum of the patient. For manual removal of mineralized dental deposits, we use scalers, hooks or curettes, excavators, files or rasps, hooves and chisels. Different colors of the picture means different kinds of manual instruments. Every instrument has its own color. Also, we can use special codes from letters or from numbers, but the majority of doctors prefer color because it is easier, it is faster. Every instrument has its own way of usage, its own kinds of movements. Maybe the most popular instruments now are curettes, universal curettes and graces. The difference is angle between working part surface and handle. You can see on the picture. We can use metal manual instrument or instrument with a non-metallic working part made of heavy-duty plastic. You can see on the picture. These instruments are manual, but also we can use such sonic instruments, and you can see on the picture below the manual instrument. The form of working part may be various, as for metal instrument. We are using this instrument for the patient with initial caries, for the patient with implants, and for children with immature enamel. We can take the manual instrument in different way. It depends of teeth and their surfaces and the kind of instrument that we use. We have to keep the instrument very tightly, so it cannot harm the patient in case of bad situation. And of course, our hand should have stable support, support on bone of the patient or teeth from opposite side of the patient or this side. But support shouldn't be on movable soft tissues, just on bone or on the teeth. Mechanical removal of mineralized dental deposits may be done with help of sonic or pneumatic or air scalers and with help of ultrasonic scalers. The kinds of ultrasonic scalers are piezo scaler and magnetostrictive scalers. The frequency of oscillation is almost the same, but the technical details are different. There are 4 ways of action of ultrasonic scalers to dental plaque. At first, mechanical destruction and displacement. Secondly, irrigation. Thirdly, turbulence. And the last way of action is cavitation. The first kind of sonic scaler is piezo scaler. The frequency of oscillation of vibration is from 25,000 till 60,000 Hz. The instrument becomes hot very quickly and water cooling is necessary. The only active surface is in this scaler, and according to this factor that is just only one active surface, working part likes gusset. We cannot use piezo scaler in periodontal pockets. We cannot use it also in case of artificial crowns and orthodontic appliances. And some questions about usage piezo scaler in children with immature enamel. The end of working part of piezo scaler moves in longitudinal direction. Magnetostrictive scalers. The frequency of vibration is a little bit lower than in case of piezo scaler, and the frequency is between 18,000 and 45,000 Hz. The instrument also quickly becomes hot and water cooling is necessary. The end of working part moves from linear to circular, and that is why all surfaces are active. Magnetostrictive scalers can be used for periodontal pockets but not for deep pockets. The following type of ultrasonic scalers is vector system. It is a very special kind of ultrasonic scaler, and the feature of the scaler is a vertical movement of the working part. And we can use special polishing powder during work, and therefore there is no needs for the polishing after our work. The frequency of vibration is about 25,000 Hz. And as I have said earlier, movements actually parallel to the surface of the root. And we can use polishing slurry, polishing suspension, and it leads to smooth surface. Therefore, it is not necessary to do additional polishing. System vector has a very wide range of uses, from biofilm removal from subgingival area to calculus removal in very deep pockets. It is the only ultrasonic scaler which can work near the apex of the tooth in very deep pockets. And some words about sonic or pneumatic or of air scalers. It seemed less harmful than ultrasonic, and we can use these scalers for children. The frequency of vibration is lower than for ultrasonic scalers, between 3 and 8,000 Hz. Sonic scaler becomes hot less than ultrasonic scalers, but water cooling is necessary anyway. The movements of working part are circular, and therefore all surfaces are active. And as a result, we can use very various shape, very various form of working part. Yes. Do you remember about piezo scaler? Just one working surface and shape as gusset. In this situation, all surfaces are active, and we have a big variety of working parts of the instrument. Laser removal is a very new and very perspective method of dental deposits removal. Mechanism of action, vaporization and ablation. Therefore, dental calculus is turned into gas and go out from the tooth surface. Laser has a wide range of uses in dentistry, not only in professional oral hygiene. Laser removal are painless, harmless, but very expensive, and laser can be used in deep pockets, and laser can be used for children too. Now some words about features of professional oral hygiene in children. In books, in textbooks, in articles, you can find information that manual instruments are preferred in children, but nowadays this point is very controversial, and Some specialists in periodontology say that ultrasonic, maybe even, and at least pneumatic scalers are preferred for children in comparison with manual instrument. Hygienist should use manual instrument with a rounded edge, yes, to prevent damage of immature enamel. Plastic instruments also are preferred. Why? For the same reason, to prevent damage of immature enamel. And hygienists should avoid contact of the tip of the scaler and enamel. And airflow. In literature, you can find information that airflow should be used in children older than 12 years old. But the limitation is not the age of the child, the limitation is behavior of the child. If the child is ready for airflow should be used. But of course we should select a proper polishing paste on the base of glycine or erythritol. I hope that the information was useful for you, and thank you for your attention.